Good afternoon, ladies and gentlemen. The Committee on General Government Operation, Appropriation, and Housing reconvenes this budget hearing on the Department of Public Health and Social Service from June 25th. I'd like to recognize my colleague that has joined me, Senator Amanda Shelton, and I know that Senator Teresa Rai is on her way. I'd like to remind the participants from the Department of Public Health that you are still under oath. All right? Okay, the conduct of this public hearing shall be as follows. Those testifying be recognized in the order just public health be recognized. Written testimony may be read. Written testimony should be summarized to about 5 minutes. Try to keep it streamlined, okay?
Yes, sir. I'm here also with Mr. Tommy Tidewee, my Administrative Services Officer, just to give him some recognition.
Okay. Testimony shall be confined to the subject. We're only talking about your budget. Person be allowed to present oral testimony. Once you're done, you may be asked to remain in the room for questions. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and may be asked to leave or be escorted, removed from the room. Fair warning, if proper form and decorum is not practiced, you will be escorted. You won't be asked, you will be removed. When you speak, please make sure that the microphone is on and that you speak into the microphone. Please state your name for the record. I'd like to also recognize my Senator Lee has joined us also this afternoon. Okay. Ms. Denarcy will now begin to hear testimony. When we last ended our budget hearing, I asked that you come back with the numbers.
Yes, sir.
No drama here, just give us numbers of what you need, what are your shortfalls, and we move from there.
Yes, but before I do, I'd just like to explain something that was not quite explained in the last budget hearing. As you recall, in FY 2019, we had $22,972,157, the Medicaid local match, and that was used to access the $79.9 million in the federal funding. And as I mentioned, I gave Senator also a copy of the shortfall of the $8.9 million that was going to come from the local funding. But what was also emphasized was that we did not tell you that the disaster bill was approved. As you know, I went to Washington, D.C. with Tess Archangel, and we did fight for it. And because the disaster bill was relieved, the Medicaid 55% match, the Medicaid 55% has increased in the FMAP all the way to 100%. In having said that, all funds that are going to be claims that are from January to September 2019 will be all 100%. So that 8.9 will automatically dissipate. So I just wanted to make that very clear. Now, had that disaster bill hadn't been passed, then, of course, that would have been a problem. Okay? So let's clarify that. The other thing I wanted to clarify is in response to Senator Lahi saying that originally we requested in the beginning of fiscal year, February 2019, that our budget for the entire department was $113,782,755, but then the overall total budget as we speak today is $107,921,834. There was a difference of $5.8 million, or exactly $5,860,920 less. So what I wanted to share that wasn't said was that the governor, and you have this in front of you, senators, the governor has already given us scheduled for the department to receive a supplemental funding of $3,098,116 to be provided through the Compact Impact Assistance Grant from the Medicaid to put for the local match. And so having that local match is not reflected in this FY 2020 budget. So that's the missing piece. And with this $3,098,116 in Compact Impact, it will add an additional $3,786,586 in the federal grant aid in terms of, if you add that 3.7 million plus the $3,098,116 in the Compact Impact, will get a total of $6,884,702, which obviously will offset that $5.8 million reduction in our original budget request. So what the governor did was, by providing the supplemental funding, gives the government of Guam the best bang for its buck, in that the identified local match, public health will be able to use the additional federal grant aid in the amount of $3,786,586 more dollars. And this will result, obviously, in a surplus of $1,023,782. And that figure is taken by matching the local and the compact impact with the federal at $6,884,702 minus the $5,860,920. And there you go. You have the $1,023,782. And so, having said that, the $5.8 million shortfall that the senator indicated in the June 25 budget hearing and her news release that she sent out on June 27, 2019. Unfortunately, the news release, and I have it right in front of me, did not specify the $3,098,106 that will be provided via the Compact Impact Assistance Grant for that Medicaid local match. And in doing so, it did not delineate the fact that $3,098,116 in local match provides an additional $3,786,586 in the additional federal aid. And so I have made copies for you, Senator, so you can see that little glimpse down here.
No problem, Linda. Why don't we let's get to your budget?
Yes, sir.
Because just to advise my colleagues also, I've also received an email from Mr. Carlson. Any funding that you need for MIP will be taken care of by the administration.
Yes.
They'll fund you whatever you need for the remaining of the year. So you don't need anything extra right now. It's all for FY20.
For right now, we're really going to be good with Medicaid. In fact, we'll have
you should be good with everything right now. Okay?
So far, yes.
Let's focus on 2020, Linda.
Yes, sir.
Thank you.
I'm with you. Okay. And so that's what I have to say. And in fact, he says the same thing that I'm saying. The administration is very aware that, we have to be cognizant of all these billings that are coming out from the private providers, because the private providers, we need them. We cannot just depend on the local government of Guam and the Department of Public Health or the community health centers to take care of these patients. You're talking about over 41,000 patients. And obviously, just the hospital alone and the public health, including the 2 community health centers, cannot do it. So it is very critical. And the administration, my governor and your governor, and they realize that we will be working with them. We're keeping them, the governor and her physical staff, abreast of all our anticipated expenditures. And we do that. I have a meeting with her every week in regards to the health, and we provide her all the information so that payments can be made.
Let's get to the budget.
Yes.
Okay.
I'm done.
Thank you. I'd like to also recognize, joined us, my colleague, Senator Tello Tairi.
Hi, Tello.
Okay.
And I have the response to your question about the PC4, if I may, Senator. Is that okay?
Ma'am, Linda.
Yes, sir.
Pause.
Yes, sir.
I advised you last week, I want to get numbers. I don't want to be talking about positions. I need to know numbers. I have to sit down in less than 2 weeks to present a budget to my colleagues. I need to know your numbers. Otherwise, I'm going to use what was submitted to us. And I don't think that's going to meet that requirement. Your budget today with 107 doesn't identify the MIP requirement that you need for next year. Okay, MIP in this current budget was $13 million. So I'm going to ask you the question.
Yes.
All the other positions that you need, it should have been part of your 107.
Yes.
That $13 or $14 million, the shortfall for MIP,
Yes.
is not anticipated for next year. Now, if Congressman Seneclas was able to get us funding somehow,
Yes.
then great. Then that money will be pulled back and used for other shortfalls you
Yes.
have in your department.
Correct.
But we cannot assume anything other than what we need to see.
Yes, sir.
Okay? Because
Correct.
there are other things that were brought up the last session
Yes.
that you don't need immediately.
Yes.
Okay, so I want to be able to, let's get back right on track because we're looking at what's going to happen in October and move forward.
Yes, sir.
Okay? Thank you. Want to present your budget, 107, and then tell us, and we move from there, ma'am.
Yes, sir. Well, the 107 is what I've indicated that we're going to have. And if we have anticipation for, right now, we're looking at in September 2019, we used to have $15 million paid for from the MIPER visits that paid from Medicaid. Well, obviously, we're not going to have that in FY 2020. So what does that mean? That means that the $15 million now will shift from Medicaid and become an MIP liability in FY 2020. That's the honest truth that I'm letting you know. And that's because ACA monies will no longer be available. And that's for the MIP patients. Those are the COFAs, the compact impact freely associated people that go to the GMH emergency room. That's why. ACA was picking that up, and now with ACA not being available, then that's going to be a shortfall, obviously, because that funding is no longer going to be around. Now, also, senators realize that there's also the possibility that we have also been asking for the 18.3 million cap to be increased, okay? Bear that in mind, and we also know that the FMAP is also being requested to increase from 55% to 100%. So these are unknowns that I can't give you an answer because that's done by Congress. And until we know what Congress has to say to us, then we can continue, as you indicated, to shift monies around so that if we have an overage on Medicaid, then we can redirect those local funds for MIP to achieve those shortfall. Okay? I do have numbers, sir, if you'd like me to continue.
Yes,
regarding,
yes, please.
I would like to address Tello's, Senator. I'd like to address your request about our PC4. That amount, and I have the numbers here, was for the step of $49,897 for the salary. The fringe benefit is $18,228, okay? And for the social worker, the MO1, that's the pay grade, it's $40,762, and the fringe benefit is $18,803. So the grand total, if you take the PC4, the salaries in the fringe is $68,125, and then the social worker too is $59,565.
Linda, for my colleagues' sake, can you tell them what the PC4 is exactly?
Oh yes, I'm sorry. Excuse me. The PC4 was for Project Carino, which is a special project for developmentally delayed individuals, children below 5 years old, that need to be assessed for developmental delays, that they come in and they receive early intervention services to address the delay, and then they can get the intervention that they need so that they can be helped. Does that
Yes,
answer
and
your
that
question?
amount total was with
Yes.
benefits and everything?
Yes, so just those two figures was the question of what we didn't have
Right.
in the previous budget. We went back, as you told us, to do our homework,
Yep.
and so Tommy and I looked at other positions. We realized that there was one position in Project Carino, it's called the Special Projects Coordinator, that was not filled. And so what we can do, so we can use that position and put it in lieu of that Special Projects Coordinator and entitle it to Program Coordinator 4. And that position is really high position, so it would offset it. So that won't be an issue.
So it's 60,000 for one?
68,125, Senator.
For one?
For total, yeah. That's
total.
for
Okay,
salaries of
thank you.
$49,897 and fringe for $18,228.
Okay, thank you so much, Linda.
You're welcome.
Thank you, I appreciate
You're
it.
welcome. And I don't know if anyone had any other questions here, but to address your issue when my staff was here, Mr. Artson Agustin, his issue was he had 20 positions currently and 13 are filled. And before that, Senator, that all these positions, the 13 that are currently filled, warm bodies, plus the seven that are vacant is a total of 20. When I first got into office on January 8th, I knew his area was a great priority and need because, you know, he's so short of staff and he has lots and lots of grants. And so I got 5 people in right away to fill. And so he also had 2 more bodies that are permanent, so we were able to give him 7 bodies right away. So right now, he still has 7 more to recruit that are budgeted. So let's focus on getting those things recruited first. And of course, when we recruit, from the experience that I have being in the government of Guam, Department of Public Health for 28 years, you're not going to be able to recruit within a month, trust me. And I can honestly say that as I'm sworn in. Usually the recruitment, I mean, I can give you an example right now. We've been trying to replace Josie O'Malley, the division head, and my position as the Community Center CEO. And look we're right now in July. I resigned when I got confirmed back in February. The positions are still not yet finished. And then I go back to ask, well, how soon? Because, you know, we're having a site visit from the federal government. We got to recruit it fast. But there are stipulations in the law that has to be followed. In other words, after they're, you know, they get the listing, then they have rebuttal if they don't like their scores, and those things take time. So I'm anticipating that whatever local shortfalls whatever lapse funds that I have, then I can also utilize that for other positions that could be provided. Does that make sense? Okay, so I think I've addressed, unless Ms. Senator Lee, you have any other questions? I'd be more than happy to answer. Of course, I'm waiting for Senator Terlahi, so.
No, we're going to move along.
Okay.
Okay, we're not going to wait for any senator. They all know the time starts at 1.
I'm good.
Is there anything else you wanted to present to us other than answer the questions?
No, and I'm really trying to do what is best. And of course, other issues will come about. As you know, there will be anticipated this or that. You know, life is that way. When I recruit, sometimes people leave. So it's an ongoing recruitment retention situation. Mm-hmm. And it happens. I mean, you know, this is the fact of life. So right now, I want to stay within our budget and rest assured that the governor and her staff are with me, and they have assured me that they will ensure that we make these payments for Medicaid MIP. And if there's any shortfall, I'm sure she'll identify other sources of revenues like she has with the Compact Impact assistance.
All right. Senator Lee, you have questions?
Sidus Masi, Mr. Chair. Thank you, Mr. Norsi, for joining us. In the previous hearing, and I guess I'll preface this by saying, you know, understanding that so many of our agencies are constantly, every single day, asked to do much more with much less.
Yes.
We thank you. We thank your team for the presentation that you gave the last time we met, and then also for today. And then I believe it was Ms. Rabago who was presenting on testimony for the Division of Environmental Health.
Yes,
is that correct?
Was.
I want to thank her for clarifying that their division has been posting inspection results on your website.
Yes.
But I just want to give you an opportunity to clarify the department's position and in terms of not following the law but doing what you can, because it's my understanding that our statute requires a certain amount of inspections every year.
Right,
and so it was alarming to me to hear that is not being done.
Yes.
And I understand that there is a level of transparency in that those things are posted up on your website, but I just wanted to give you an opportunity to clarify that a little bit further.
Yes, absolutely. You know, there's so many thousands of establishments in Guam, and there's just so many people. He has about, I would say, a little bit over 25 staff in his position.
This is Mr. Nadeau.
This Tom Nadeau.
Okay,
Yes,
thank you.
yes, ma'am.
Nadeau.
And so what he's doing is he's leveraging stability within his own division by having the diversion funds and also the environmental health revolving fund, so that they will generate whatever fees that are involved so that they can save and continue saving, so that money can be earmarked to recruit more environmental health specialists. Right now, he has 5 positions that are already funded in our budget that he is also aggressively recruiting at this time. But to answer your question, I mean, even if we had, it's going to take him, as you know, it's going to take him lots more than 25. I mean, maybe triple that amount. There's no way that we're going to be able to have even the manpower to do that. So what we do is we get the help actually from the community, because they're really our eyes and our ears to identify any place that they eat and there's probably a cucaracha or a rat, and they will identify that to us, i.e. example, you know about Pacific Star. That was a public health area where we did the training, and the cucarachas just keep coming all around. And so these are ways where we can offset the fact that the public is helping us to target those establishments that really need to be inspected or shut down, if that is the case. I mean, even if we hired and we beefed up, it's going to take time. I mean, right now, he has 25 people, and even the 5 positions that he's trying to recruit, these positions that he has are very specific. They have to be certified positions as an environmental health officer, a specialist. And the pool that we have is it's really tough, just like hiring more nurses and doctors. It's not something easy that's going to come right away. In fact, let me add what I've done to share with you. We have to leverage sources. And yes, Dr. Kaneshiro was here saying that we don't have enough nurses. But guess what, Senator? I cannot allow for a TB outbreak to occur or a vaccine preventable disease to occur, such as measles that's happening throughout the United States. What did I do? I utilize our community health centers that have tons of nurses. We have about over 20 some nurses. Poor Central Manila only have like a handful, maybe 5 or so. What I'm doing now, I'm assigning those nurses to work in the Department of Public Health at Central. They're not federally funded because I don't want to violate any laws with the federal grants. They're staff that are either Healthy Futures funded or local fund, Healthy Futures or special funds, right? And so they're helping the TB program right now to follow up on all these cases of exposure to TB, because right now that is my big thing, is TB. And so that's what I'm doing. I'm leveraging all the resources that I have, putting them together. And I'm not going to sit by and let the measles outbreak occur in Guam. I'm going to have to utilize my staff to do outreach, and that's what we're doing. We're going into the boondocks. We're going into these isolated areas where there's no power, water, electricity, but we don't advertise that. We do that every month so that we can immunize those kids or those adults that are in isolated areas that have no transportation, no means to come to the health center. We bring our doctors and our staff out there, and we've been doing that since the grant that we had, which was the ARA grant that expired in 2009. But even though the grant expired, we continue to operate to do it because we leverage resources with our partners, i.e. University of Guam. We tap on all the other programs within the department and also legal services to provide a comprehensive service for the people. And that's what the federal government needs, the partnership. So I hope I've addressed that.
Thank you very much, Director Denorsi. And I can sympathize and understand your position. You don't want to give up one area of concern for another area, but as we well know, there's many issues that are on our plate at any given time, and we need to address all of them.
Yes.
They're all important. And so I understand that the statute notes that these inspections must be done once every 3 months, and that the director shall inspect every establishment or activity as subject in the chapter that we're referencing. And the date of inspection shall be noted on the permit. Is that still?
That is still in effect. And in fact, we're releasing reminders to all of them. We give them a whole sleeve of, I just signed it, to tell them, please make sure you come for your training, and when your certificate expires, your health certificate, make sure you get it renewed. Otherwise, you cannot work in an establishment.
So maybe this is something that you can help me try to understand the bigger picture in terms of, because we're not able to meet that every 3 months as issued in the statute, and you are providing the date of inspection on, it's noted on the permit. Are any of these permits, like what's the longest period that they go without inspection? Is it a year? Is it 2 years? What's your backlog like? I know you mentioned
Yeah.
you only have 20, 25 people, but
Right.
it's difficult for me to kind of think about
Yes.
all of the different restaurants and establishments that we have
Well,
on
we
Guam
try
and
to make
how
it at
long
least
they might be
right.
going without
At least
inspection.
within a year and a half at the most, we're trying to make certain that
And
they're
you're certainly
inspected.
relying on the public.
And the public too to help us. And of course, there are other times where our inspectors are needed, i.e. the CBD, they're asking us to look at that, and
Understood.
i.e. festivals that are occurring with the different villages,
Right.
the Mango Festival, and then the Pleasure Island thing for the barbecue
block party. Yeah, that's this
and all
weekend.
that. So, my inspectors are also pulled in every
Understood.
direction.
So if that's the case,
Yeah.
Mr. Norsi, could you please provide the public and those watching at home a phone number where they could call
Yes,
in if they have
absolutely.
a concern? What would that phone number be?
Yes, I have it on. Three. I have it on my phone. I just have to go to my purse and get it.
Okay,
Is that
actually,
three.
yeah.
Yeah. 735-7216.
735.
7216.
7216.
And if they have any hard time getting through, they can call 735-7102 and ask to be connected to the Environmental Health Division.
Excellent.
Thank you.
Okay, moving on. You had mentioned in your presentation previously that you have a large group of employees that are approaching retirement. And
Yes,
so I just wanted to
34% of our population
Right.
that are retirable, including myself. Yes, sir.
and that
ma'am.
was very alarming to me and
Yes,
concerning to me.
very.
So I just wanted to give you an opportunity to explain to the committee what DPHSS is doing to retain institutional knowledge in
Yes.
your department given this
That's a very,
crisis.
very good question. Thank you, Senator, for that. I'm a prime example of how important it is to have a succession plan. The board of directors, when I was the CEO at the health center, has constantly reminded me that I have to start grooming. And before I left the health centers, I was able to groom about 5 people to do the job that I did. And so we should really, and this is what I'm enforcing, what was enforced down to me by the community center board. I'm telling every single division right now that they have to start grooming and they have to look at young bloods to take over, to take the leadership role, because one day, whether or not we're ready to retire, if there's a catastrophic illness in our family, whether it's their mother, their father, themselves, guess what? They got to go on emergency leave. And who's stuck? The rest of the staff. So what we did at the health center is we were mandated to have a recruitment plan, and we had to show the type of recruitment as far as what is our strategic recruitment plan for that. And so that's what we were able to do. So right now I'm doing the same thing that the board had asked me to do prior to taking on this job. And I see that it's very, very critical. Because, one day I might leave too, right? I mean, I can't be forever at public health. I've been there for over 28 years, and I'm already 33 years as a government public servant.
Right.
33 years and counting. So maximum is 36, right? So the mathematics is like 2 more years, right? Or even less. I mean, I'm just saying that.
Thank you very much. I also just want to congratulate you and the team on the great results for the Carino program. I think it's a really great one. And you also mentioned in your presentation about the Guam Family Planning Program.
Yes,
and that's
that was recently awarded.
Right,
And
so
with the
that-
family planning program, what we're doing is we're also working with all the 3 health centers, the North, South, and Manila Public Health, and we're going to avail a lot of education and information about contraception throughout, all the way from, including abstinence. We're going to provide that education. I'm not going to talk about the big A word because that's not permissible in our grant.
Okay, yeah. So with regard to the program itself, it provides comprehensive reproductive health care to low-income women, men, and adolescents
Yes.
to prevent unplanned, unintended
Unintended
pregnancies
pregnancies,
and
correct.
unwanted STDs, STIs.
Yes.
So this program you were mentioning, it's funded by HHS, correct?
Yes, that's through HRSA, Health
Okay, and
Resources
what's the
Services
total
Administration.
grant funding?
That is a little bit over, I would say about close to $300,000+.
$300,000
And that's going to
annually? For how long?
That's for a 5-year cycle. And that's going to fund also positions for nurses and also a nurse practitioner or a physician, as well as staff that will be working on trying to get funding so that they can establish their own special funds. And I will have to speak to Senator Therese Terlahi regarding that we already did the first step in establishing a fee schedule. The next step will be to establish a special fund so that they have a revolving, so
Right.
that they can make their own money,
So that's-
become self-sustaining, and not depend on local funds to subsidize the program should the grant end in 5 years, like we have
Right.
a problem with Carino.
Okay, that's my next question. I just wanted to clarify. That's $300,000
About 300 yeah.
annually for the next 5
for
years.
the next 5 years.
Okay, and
correct.
then is there a local match
No,
component?
it's 100% federal.
Okay.
Yes.
Are these efforts done in coordination with the Attorney General's office? Because it's my understanding, this body passed the Lonnie Kate law several
Yes.
terms back, and under that statute, the Attorney General shall convene a task force, and there's a presiding officer selected, and all of those things to ensure that our community is educated
Yes.
about.
We're reaching out to
Family
everyone.
planning and-
In
okay.
fact, we've been reaching out to the community as a whole to ask all the other private clinics to join us in this effort. So, absolutely.
Excellent,
Yeah.
thank you. And if you could provide continuous updates to the body about that, I'm
Sure.
very interested in that. I also wanted
Would you
to...
like a copy of the grant? I'd
Sure.
be more than happy to send that to you.
Excellent.
All
That would
right.
be great. I called your office, I believe, earlier today or maybe a few days ago with regard to this question, and I wanted to just let the public know. I know many people are aware that they're already starting to move towards banning styrofoam at University of Guam and
Yes,
GCC.
right.
Here at the Guam legislature, it is not allowed. And so I wanted to ask you, if we included a ban on styrofoam with government funds, how would that impact DPHSS?
Okay, that will be something that I'd have to do a study with the environmental health staff. Usually styrofoams and anything with environmental health to that regards, I just checked with the environmental health. That's more or less with EPA, depending upon what questions you have regarding styrofoam, whether
So
you're
what
asking
are-
for storage or whatever.
Yeah, in
But
terms
I
of
would-
what you use, like
Yeah.
DPHSS supplies, are there a great amount that are...
No, we don't really deal with styrofoam. I've been asking them about that, and they said they don't deal with styrofoams at this point in time. Even to inspect, if one of the questions I said, well, what if somebody were to store food in a styrofoam? It cannot be reused. It cannot be desanitized at all. So
Right.
it's just one use, and that's it. Get rid of it.
Yeah, and
so,
that's the problem with it. Yeah.
And of course, we're trying to do recycling, and it's very important for our environmental climate, especially with all the climate changes and all that issues that are happening in the community. So I would like to investigate it further and see, but right now we don't even deal with anything with styrofoam programs. So I'm sorry, that's
This is
where we
Marcy.
stand with DEH.
Thank
Okay?
you. Thank you very much, Mr.
You're
Marcy,
welcome.
and thank you, Mr. Chair.
Thank you. Linda, I'd like to express that I support that when you mention the fees,
Yes, sir.
and
I
once you,
believe in sustaining because
once
really,
you route that to Senator Terlahi, I'll get a
Yes.
copy of it, and then we'll support that.
Right.
Because I like to see the fees start. When folks have to use the service, they should pay for it.
Exactly.
There's just too much things that are free. in the
Exactly,
government.
and the federal government is moving in that direction, Senator,
All right.
because even the family planning program requires us to bill third party, MIP, Medicaid, everybody. So you're correct. They are moving in that direction.
Okay. Before I go to the oversight, Senator Tello? Because I
Thank
know
you.
that once I pass the oversight,
He's doing
all the
because
questions will be open up for,
I greatly appreciate it, Mr. Chair. I know that I asked for this because I have to leave right after that. But I'm glad to hear that my friend over here, Senator Fiscal Lee, is also a big fan of Carino and that we have to move forward on it. You
Yes.
mentioned in the last hearing that you weren't sure when the grant would be.
Yes.
Yeah.
As soon as I
and this
find
is the
out, I'll
problem.
let you know.
So let's say we were able to put some money in there, and for now, does that jeopardize your opportunity of getting grants? Because sometimes they don't give grants if it's already funded. So if it's best, we just
Yeah, just hold.
hold back?
Yeah, well, because if you have something funded and they give us more funding,
Exactly.
then, that's going to be an
Okay.
issue.
So, Linda, you came today with your budget being the same, and you're sticking to your guns on that. And I think if there's anybody that's an advocate for public health, it's you. You've been there forever. You know the ins and outs. But I think
Not-
you have a lot of confidence in our governor to ensure that if there is funding needed for MIP in that area that we're all concerned about, she will find that money through, like you said, compact impact. That money will come to you if we run into that situation, because it's not just MIP not only funds the coverage of medical expenses, but it also covers what I mentioned, and that was St. Dominic's.
St. Dominic's, yes.
And we already identified.
Sister visited me, by the way,
Yeah.
Senator.
Yeah.
She really did. And the visit was very welcoming. And I told her there's a stipulation in the law that requires intermediate care, and I'm bounded to follow the law. And she wants to revert it back to custodial care.
Okay,
and
great.
that
That's good.
is an issue that is beyond me at this
Well,
point in time.
If anything,
But I did-
that's
Yeah.
$2.5 million.
Yes.
48.
$190 per day times, of
48.
course, yeah, all the way times 36 people that are there right
I
now.
thought it was 48. It's not. It's 36 now.
It's 36,
Okay.
Senator, based upon what Sister Therese, sister told me, and I have the phone which has the exact figure, but
Okay.
I calculated it myself too, and it's
So-
about 36 patients. That's what she said to us when
Okay,
she saw us.
so Linda, you're comfortable with the fact that 107 is enough to do with, that
Yes,
you're good to
because
go
of
with
the-
it, and Corrido, you're going to assess it because we don't want to lose out on any funding.
But I have the position that I said was vacant that we identified
That
for the
you can
special
have
projects
somebody
coordinator that I'm going to
Keep the
recruit the
program
PC
growing.
for in lieu of that.
Going.
Yes.
Keep the program going. That's very good, and I'm very comfortable with that.
Okay.
And like you said, if there is money needed for MIP, that the governor is going to step up to the plate. And so we
I've
don't
been
need to
doing
look
that
for
since-
$13 million because it seems the governor has, well, she has transfer authority, number one. Number
Yes.
two, she has compact impact. She's got all those other
grants,
fundings.
yes.
So I appreciate
And
you
I can
letting us.
honestly tell you, Senator, and I'm telling the truth, I'm one person that will see the governor if I need money, and I've done that since I took office in January. And I
Okay.
see Lester, and I see Mr. Byrne, and I'm with her in her meeting with Tess.
Okay, thank
So
you so
please
much,
know
Linda,
that I've been
and please,
an advocate for the people of Guam.
thank you so much, and thank you, Mr. Chair, for the opportunity.
Okay, thank you, Tel. And before I proceed to the oversight chair, I just want to make it very clear. 2019, you had about $14 million for MIP. We still intend on trying to make sure it's included in your budget, even though the governor may find the money somehow.
Yes.
But in the shortfalls that you may have in public
Yes.
health, you'd have that flexibility to
To move it,
To move
depending
it-
upon the Medicaid situation, as I mentioned,
Exactly.
if they do end up removing the cap and increasing it from 8.3 million to a lot higher, and also if they change the FMAP from 55% to 100%, then what we're gonna do, we're gonna strategize. We'll now no longer need the Medicaid match from the local, and then we can shift it all to MIP.
Yes, and in the event that our Congressman Seneca is able to find another source of funding,
Yes.
that can also assist you in the other programs that you need to
We'll-
make sure
yes.
you're servicing the people until it kind of like
Yes,
slows
sir.
down. Okay?
Yes, sir. When I was in my hearing, before I got confirmed, there are goals that I want to do to accomplish, and I'm trying to take that off my list as I
Your
go
bucket
through.
list, huh?
Yeah, my bucket list, so please know that I'm working on
All
that
right.
too.
Senator Terlai, the oversight chair. Ma'am.
Thank you, Mr.
Yes, Senator.
Thank you, Tom. And I apologize for my delay. Something unexpected came up, but I appreciate your patience. But I did hear your testimony, and then the chair just followed up on the MIP for 2020, for
yes.
fiscal 2020. So the plan is to use to shift Medicaid if we are successful with our
Absolutely.
Medicaid asks at Congress.
Yes.
And then, so to leave the Medicaid amount as is in the
Yes.
2020 budget.
Yeah, because
And-
we received the disaster bill when we
Right.
were in the last hearing.
Yes.
We were just showing you if nothing happened, but because the Disaster Bill Act passed, then that 8.9 million that I was indicating, that you also indicated in your press release, will no longer be an issue because it's 100% match.
For FY19 though.
That's for,
Right.
yeah.
Okay, yeah, no, I'm talking about
Correct.
FY20.
Right.
If we could just stick to FY20.
Sure.
So your Medicaid amount, is that satisfactory?
Yes.
The budgeted Medicaid amount for FY20 is
It's
enough,
satisfactory for now.
even without passage of any of those two asks from Congress?
If we're all good, then it should be okay at this point
Okay.
in time.
So it would be a great plus for the MIP, which is
Yes.
low,
Absolutely.
to if we're able to shift some of that Medicaid match. And if we
Yes.
are able to shift, is it enough for the MIP?
Again, Senator, I can only do projections based upon expenditures. That's the best I can do, Senator, and I'm speaking
Yes, of
as
course.
the truth.
Our whole budget is based upon
What
current
we have.
expenditures and what we're
Exactly.
looking at, yes.
So I can only tell you what I see now, and anything that's going to happen in the future,
all
we're
we're
going to have to
asking.
deal with it as we go along with the type of claims that are received.
Yes.
Because again, the types of claims, whether they're for adults, regular Medicaid, or CHIP, it's going to be dependent upon those types of claims and how much monies we're going to maximize the federal dollars for. And that's what we do. When we do the claims, we put it in the right bucket of the different Medicaid programs. And that's how we process these claims.
Yes, and you've done a very good job, I think, or at least you've shown to us, Public Health has shown to us that they are very good at
We're
getting the
creative.
best bang for our buck by,
Yes, we get the best
allocating
bang for our buck.
correctly, yes.
And you
But-
were late, Senator, so I did pass this. I don't
Yes,
know if
I
you
have
got
it, and I
Okay.
heard your
And I
testimony,
just,
so I wanted to let
so
you
I don't need
know.
to repeat it.
Yeah, so,
Okay,
no, I'm not
got
asking you
it.
to repeat, I'm asking you for
Sure.
the FY20, if you shift your Medicaid,
Yes.
as you propose, is that enough to cover the MIP shortfall for 2020? Based on, this is what I just asked you, and you said, based
Yeah.
on what you've seen for FY19,
Uh-huh.
of course.
Well, again, it will be sufficient for the 2019, and as we go journey through, again.
No, I'm asking for 2020.
2020.
The 2020 amount for MIP is short. We all accept that, right?
Yeah, right.
It's significantly short. And the plan so far is to shift Medicaid, or hopefully
Yes.
shift Medicaid. If other things happen, we can shift
Right.
Medicaid. If we shift Medicaid, is that enough for MIP?
Yeah, well, right now, because we are authorized a carryover, we still have about 41 million and an additional altogether 65 million that still needs to be spent. So that's going to be consumed. And so having said that, then that's going to be also utilized in 2020 when we get through.
And what money is that?
That is from
Medicaid?
the ACA, the leftover.
Okay, the
yes.
leftover, so 65 minus 41?
That's going to be the amount for that would be 65 million altogether.
65
Yeah.
minus
And
the
41
41
million,
you said are
that
pending?
includes the 41 million.
Oh,
Senator.
okay, so 65 is the balance.
Right, plus 20, I think it's just 65 minus the 41 is the
And so
remaining
that will
from the ACA.
also be available in 2020, you're saying?
Yes, in the
for
beginning of the-
Medicaid?
yes.
And possibly if the rules change?
Yes.
That also can be shifted to
Could be.
MIP?
It depends,
That's what we're
yes.
hoping.
Yeah.
Okay, great. All right, and I understand what you're saying about, we're going to allow for transfers. The issue is that, we've gone many years without,
I know.
we
and
can't
I'm-
control those things after the budget's
That's the
passed.
sad
That's why we
part.
want to make sure that, if
Yeah.
we can, if it's a priority, that we put it in. But,
Yes.
so,
Linda, like I said earlier, last year it was budgeted about 14 million for MIP.
Yes, that is correct.
We're still looking at putting that in.
It's already in there, sir, but what we did was we moved it to Medicaid to get the better bang for our bucks. So in
Understand.
order to get more federal
It's- no,
dollars.
it's in today.
Yes,
I'm
it
not
is
talking
in
about
today. Yes, it is there. But
Linda, I'm not talking about today. I'm talking about October on.
Yes.
Stop thinking about today, because everything we're talking about is from October on.
Right, you're right.
Right now,
Yes, I
from
understand.
October on, you have nothing but about 600,000.
612,000,
Okay.
yes.
We're trying to stay focused in the case something was to happen. We want to make sure that MIP, which is only general
Right.
funded, okay? It's not
Yes.
coming from anybody else.
That's why I indicated to you with the FMAP 100% match that
Right.
is expiring in September 2019.
You have enough.
Is no longer going to be paid for the MIP ER visits, and that 15 million will have to shift from Medicaid to MIP
Okay,
for
so
2020.
you don't need, right
That's
now,
going to have to shift, so there's a liability on MIP. If nothing, if again, if FMAP doesn't increase and we don't have the cap, then that's what's going to happen. But if we have the FMAP and the cap changed and increased, and the cap is no longer at 18.3 million, then we can also take the local match from the Medicaid and move it to MIP.
Okay.
So that's what we're faced
All right.
with.
So we've got several scenarios going on.
Yes,
So yeah.
unknowns.
If you don't mind, just back to the first scenario. If we get all our wishes at Congress,
Yes,
we are able to shift the Medicaid.
local match.
Yes. And what's the amount? 65
Well, I'm hoping
plus,
that I will shift about 15 million to MIP.
Okay, 50
Yeah.
million to
To
MIP.
pay for the MIP ER visits that no
All right.
longer
And
can be
is-
paid for by
So
Medicaid.
my question to you is, if that's the shift, because
Yes.
right now MIP is only showing 600,000.
Yes.
Is that enough for MIP for 2020?
We're hoping, again, I don't have a
Based
crystal
on
ball.
2019?
Based on that,
Yes?
yes. Well,
Reasonable?
That's what I'm gonna,
It's reasonable in your opinion?
for now, and things can be, I mean, there's no guarantee of what kinds of claims we're going to have in the future, so you're asking me to answer
No, I'm just
something I
asking
don't
you
know.
to be reasonable as you were in projecting the entire rest of your budget. These are projections,
Yes,
right?
they
Based
are.
on
Claims that have been
yes,
processed.
so that's what
yes.
I'm asking you to do, yes, for 2020. So you think that would be reasonable to put that amount to MIP, 50 million?
I hope so.
Okay, what's the current 2019 expenditures for MIP? Or
for-
what's the total you're expecting expenditures MIP 2019?
Oh, okay, sure. I got
Just
that
so I
figure.
want to compare
Sure,
it to your
no
50
problem.
million. Yeah.
So the MIP total expenditures, we deviated it out. Currently, as we speak, as of the 28th of June, it's 11,925,612.20. Now, we are projecting the next 3 months from July to September an additional 3,975,204.07. And so, having said that, those two figures will amount to 15,900,816.27. And that's the 11,925,612.20 plus the 3,975,204.07, which is the projection for the 3 months. And that gives you 15.9 million.
Okay, I appreciate that.
No problem.
So is it reasonable then if we calculate, let's say 2020 to be the same, approximately 16 million, plus you're saying an additional liability of 15 million because of the ceasing and the ACA.
Of the ACA,
right?
correct. Yes, ma'am.
15 million, so about 30.
Yes.
All right.
About 30.
But,
Correct.
okay, and when we, could you just talk to me very quickly about this 15 million for ACA? Because the amounts that you've actually spent are higher than that. So how do you calculate 15 million? Aren't they higher than that?
Well, that was because that was what we utilized based upon what was given for the ER visits based upon historical data.
15 million, you
Yeah.
mean? Oh, okay. So,
Yeah.
just
That's
for
historical
ER
data that
visits.
the ER visits night for the COFAs. These are people that are the
Yes.
compact impact
Right.
of freely associated states that go into the emergency room because they don't have insurance and they don't qualify for Medicaid night.
Oh, okay.
Yeah.
But what about all the rest of the currently covered under ACA
Then
kind
they
of
will
care?
fall under either childless adult, or they'll be regular Medicaid, or they'll be EAP, or whatever the categories they will land under.
All right.
So we're anticipating for that, we are going to have the MIP, and the revenues are obviously for MIP is 100%
say that one more
local. The revenues all for MIP is all, it's all 100%. There's no federal dollars.
Right.
Right.
So we can expect a mirror of this year of a minimum of 16 million plus the 15 million ACA emergency room only liability that we will incur.
Correct.
And if we were going to cover anything else in addition to emergency room
Yes.
under MIP, it would take more. So that's
Yes.
30. If you're able to transfer 50, then you have a little bit of a cushion there, right?
Correct.
Okay. Yes. So if in 2020 again, another scenario is if that money does not transfer, the Medicaid match, right?
In other words, the Medicaid does not increase in its FMAP, right?
Right,
Or
right. None of those-
the cap is not increased.
Correct.
That's what you're
So
saying.
none of those
Okay.
changes are made. So we're going
Yes.
to go through
The
another
worst
year
case
of
scenario.
just regular Medicaid without ACA.
Yes.
Then you would look at, so then I want to look at MIP, okay?
Okay.
So, because all that ACA coverage gone.
Gone.
So we're looking again at 16 million kind of expected
Yes.
in MIP, plus the 15 million.
Plus the 15.
That's emergency room.
Yes, ma'am. You got it.
And you're saying that this, I heard you talking about the compact impact, but is that for 2020? Is this when?
The compact impact that the governor is giving us, yes, that's for the earmark for 2020.
2020, yeah,
Yes,
that's what
yes,
the
ma'am.
footnote shows.
Yes,
That's for
that's what I
2020.
meant.
Okay, so
Yes.
that would be about 3 million.
Yes. And
That's for sure. Yeah, so that's
Yes.
about,
And then you have on top of that the 3.7 million from the federal match, because we have a local match, so now we can maximize our local dollars by getting federal dollars.
but you said the compact impact. Wait.
Yes, this is the compact.
going to,
This is the compact impact assistance grant that the governor has purview of.
that's for
Yeah,
Medicaid.
that's not in the budget though.
That's for regular Medicaid.
That's for Medicaid. Yes.
Oh, okay. So how does that, yeah.
So it's a
Without the
55%.
congressional changes, how does, what's the backup plan for the MIP?
Well, we have other ways
I
to
thought
look at
that-
it. If the congressional doesn't change as far as the FMAP increasing, or
Right.
one of the things that Tess was talking to me about was right now we have the Medicaid at 133% of poverty. What we may have to do is reduce it to 100% of poverty, like it was originally from the beginning of how Medicaid and MIP started. So we're going to have to revert back to that.
How many people do you anticipate that will make ineligible for MIP?
Okay, that's the data crunch that we might have to get back
Oh.
to you, unless my staff would know that offhand.
Yeah.
Yeah, that we'll have to look at.
Are you thinking like hundreds of people, or? I don't know. Okay, I'm curious.
I don't have any figure
that's very-
on that.
yeah.
If you had asked me earlier, I would have gotten
I know
it,
you're
but
concerned
sorry.
about this because, yeah, I know
course.
it's very concerning that we're going to cut eligibility
Yes,
already, and we're asking Congress to raise our poverty levels, and then we locally cut our poverty levels.
Yes.
That's
and that was before we
Very
had the
concerned.
ACA.
yeah.
So we wanted more people to have
Yes,
the
be
opportunity
eligible.
to shift from
Right.
MIP to Medicaid.
Right. So that, in effect, would cut the number of people eligible for services, and all right.
I know it's an ongoing cycle, Senator.
No, it's.
I am sorry. I mean,
Okay.
it is what it is. We're not the
Yeah.
only ones. It's everywhere throughout the United States. It's a big
Yeah.
issue.
I know, but we're in a Medicare.
I know.
I mean, we're in a patient care. I think crisis
you're,
also.
You're talking to somebody that has
Yes,
been
I
with
know.
the primary
know.
care for a long time.
Okay, so what would be the amount? Let's wait. Well, sorry. Let me just think out loud. We've got 600,000 so far for MIP in the 2020 budget.
Yes. And then we
Plus the
also
3
have the
million
cancer.
oh, no,
Don't
sorry.
forget the cancer too. We have the cancer for 800,000 and 200,000 for the cancer from the special funds, and also the Healthy Futures funds. That's another $1 million.
But are they going into MIP?
Yeah, that's going to MIP. And we also have,
In addition to the 600,000?
yeah,
Okay.
that's in addition.
How much is that?
That's about $1 million.
Okay.
800,000 from the general fund and 200,000 from the Healthy Futures funds.
All right. I guess I'm just trying to see how this looks, because transferring what looks to me now like if we get the million sum plus the 600,000, maybe 2-3 million, let's say we've got for sure. Yeah, but we need a minimum of 16 million, no, 30 million, right? To really cover the existing MIP patients.
Based on estimates of
Yes.
prior year expenditures.
All right, and I agree it can be done by transfers, like it's just hard to imagine that amount in transfers is significant, and the impact on another agency by transferring that amount of money throughout the year is really going to impact other
That's why
agencies.
we meet with the governor every week, and we give her everything heads up, and we let her know. And
Yeah.
also Lester has assured me, the DOA, BBMR, that they do have a way to track all the revenues as they
Yes.
come in, so that they can know, their
Yes.
cash flow and all that. So
Well,
they're-
from our perspective, we do this budget in the beginning of the year, and then, they do all their tracking. But the problem is I want these agencies to also plan, right? And
Of
so
course.
we're going to be cutting another agency by, at least $15 million. It looks like we're going to need to transfer. I would like to know that up front, and I would like the legislature to just be involved in setting that kind of priority. And I think
Yeah.
we're willing to do it, but I
I'm hoping, Senator, that we will find out from Congress what's the outcome with the FMAP as soon as possible. I'm really hoping that they will make a decision, and also with the removal of the cap, or at least increasing the cap, and with the FMAP increasing from 55% to hopefully 100%, like what they did with the disaster bill, then I think once we know that, then absolutely we can move forward
Yes.
and having
So
a better picture.
so you think we're going to know that before the
I hope so.
FY20?
I don't know.
Oh,
I'm
see,
not Congress.
I was not expecting that at all.
don't know.
If you think that's
Yeah.
possible, then maybe
I
I'll be
will
more
find out.
optimistic like you.
I like to be as optimistic as I can doing this job, of course. We will find out. We've been in communication with CMS, and staff have also been meeting with CMS, and we communicate a lot with them, my staff back here. And I met with them personally also when I went to San Francisco with Tess right before we went to Washington, D.C. So I know the faces there, and we're planning to visit them again. So I will keep you on the loop once I find out.
I know you've been working on this. I just
Yes, we've been really working
I just thought the
on
Congress
all
acts
the-
slow, but we'll see.
Yeah.
I hope you're right. So, and I know the congressman's
hope so.
working on this. He didn't give a time frame either. So I'm
Yeah.
just expecting that we should act as if it's not passed until it's passed, and then great, it's a great windfall, right? And we
Yeah.
can transfer that at that time. But all right. And just very quickly for FY19 shortfall MIP, you're saying it's going to be covered by transfers, but not from compact impact. The compact
No.
impact for 2020
It will
only.
be
Okay.
if the local match from Medicaid, because if we get FMAP at 100%, then we're able to
No,
use
for,
that.
for
Yeah.
2019.
For 2019. The expenditure that I projected, we're going to be able to utilize if all this happens and there's the surplus, then we'll be able to move it. Yeah.
You mean if the Oh, no.
I'm sorry. Did I get what is your
Yeah,
question?
just for FY19, I wanted to confirm, to cover the shortfall in MIP for
Yes.
2019, you don't intend to use compact impact. That's not, the compact impact discussion
It's for
was solely
Medicaid.
for 2020
Yes.
Medicaid, right? Okay, so for the MIP, the shortfall for 2019 only is going to be covered out of miscellaneous lapses.
Yes.
Do you have lapses in your budget?
Yes, there will be lapses, obviously, when the recruitment doesn't go through with a lot of the positions that we have throughout our agency. We have lots of positions that are vacant. So Tom has been in this business for a long time like me,
What do
and we
you
do
estimate?
anticipate.
What do you
Tom
estimate your
can
lapses
answer
to
that
be?
question.
2019.
As of the last time I checked, right, it was approximately like March, mid-March. We're looking at like a lapse of like 800,000 right now. In addition to more, that's it's dependent. It was dependent upon the match requirement from Medicaid, and now that we're not able to avail to it, I mean, now that we're able to avail to that money that we put aside for the match, you have upward like 1.6 million right now.
Oh, that's great. Okay. I mean, you can use that immediately for MIP without any additional. You
Yeah,
can.
I can move it.
That's
If you
great.
give me that authority, I can move it.
No, do you need authority?
I have that authority.
You have it, right?
Yes, ma'am.
Okay, good. All right. 1.6, and so then, what did we say? What are you looking at for the 2019 liability?
For MIP,
Yes.
4.8 million.
How much?
4.8
4.
million.
Okay. And you've got a
Already 1 million.
1.8.
Yeah.
Okay, so 3 million more, and transfers or something else from another agency? Because it can't be from your
Well,
lapses.
if you
so
don't
probably-
use the cancer funds, we may be able to use that too, the cancer, the 1 million, the extra 1 million, or no, it's even. Okay.
It's already been,
No, that's all right.
it's already been
We'll
used.
just have to work with what we have in the budget and identify other lapses that could be from other object classes like supplies, contractual. Probably we'll cut down on our travel if worse comes to worse. That's
Is-
what we'll do.
Is the lapses amount that you're estimating for department-wide?
Yes,
Okay. All right, that's
Yeah.
pretty much from not filling positions in time?
mostly personnel, yes.
Yes,
Yeah.
a lot
All
on
right.
personnel.
Yes.
Yeah.
Okay,
It's about 180, right, personnel altogether. Yeah, 180.
yeah, so my biggest concern is that, we see it when one of the examples was when we said it's, I think Tess was saying it's more efficient to pay for the foster care children under CHIP. They're covered 100%, as opposed to putting private money.
Yeah,
to pay
CHIP is
private
about
insurance.
91.5%, and then
Yes.
8.5%
Okay.
local match.
Yeah, so much better value
Yeah.
that way. The problem was that they were talking about providers, and not all providers are accepting.
Oh, I addressed that issue, Senator. I
Okay.
just met with American Medical Center with Dr. Nguyen, and the providers don't have a problem because I was concerned. They invited me to come and meet with their pediatrician, and we went there, the deputy and I. I asked them, because remember that issue came about with
Yes.
the health insurance, right?
yes.
And the health insurance is budgeted, mind you, and also the foster care group home of $864,192 in this
Yes.
budget for FY 2020. I asked Dr. Nguyen, is the problem that you're so feisty about with them being under Medicaid? I mean, you don't like Medicaid, you just like the private insurance? He says, no, Linda, that's not my issue. I don't have a problem with the delay in the payment. I don't have a problem with the funds being lower. What I do have the problem is the prior authorization is a pain because it's so hard to get through to talk to somebody and then get, the prior authorization approved in a timely fashion. And then the pediatrician says it doesn't match the prior authorization timeline with the dates of when the child is coming in for well baby care checkups. And it's not only going to be one time, it's going to be multiple times. So you want to bring them in for the well baby care and align that also with the vaccination shots that have to be given to the child. So I told them, we're going to fix this. And one of the things, and I'm not only hearing it from him, I'm hearing it from the health centers
Yes.
and other providers. So, and also pap smear patients. I mean, I spoke with Dr. Berdalio and her team, Ellen Bez and Mariana, and a lot of women want to get pap smear screening, but the problem is getting the prior authorization. So what my envision that I want to fix is I want to get rid of this prior authorization and make it so simple so we'll have like a listing of all, just like you're an insurance company and you have your listing of all your clients, right? So let's get all the foster kids where they want a panel. Do they want to go to AMC? Do they want to go to SDA or whatever clinic? And then let's have it so that they're paneled just for that provider. And that way, all you do is you send to us an email or a fax saying, this child is going to be seen. And then we say the only reason what we're going to do is we're going to say approved, and we'll pay you. That's all. Instead of all this, excess time spent trying to communicate with each other, it's really a waste of time. And what I want to do is I want to make it so streamlined so that all we get is the document that we need to justify that that child was visited and to prevent duplicates. And I think that was the reason why the prior authorization was put in place, to contain cost, so that this child doesn't go to multiple, pediatricians within a short period of time, and then you waste money, right? So that was the reason for that. So I want to streamline it and make it, like we're strategizing it right now, and I just responded to Dr. Moegan, and I said, we're going to sit down with all the staff, we're going to put our brains together, and we're going to make it so simple, and I'm planning to write a letter to all the providers and let them know that this is going to be a big change, because I'm the new kid on the block now, and I really want to make it so that it's not a barrier to care. I want to make it that it's going to be an access to care.
Great. That's fantastic news.
That's what I want to do.
Yes, and I'm looking forward to you getting that out to all the providers. That's a great example. Yeah, because what I don't want to do by not putting what we really need into the budget and counting on, late transfers later or something else is that we just can't, plan for it, and I just don't want to end up by, something else ties the hands of, transferring money from another agency. But I just don't want to go backwards in what you guys have done so far. You've really developed a reputation that you can get these claims paid efficiently.
I'm trying. I mean,
yes. So
Regional Medical City is here, and they submitted claims that were of the past, so we're left with that.
I know you have your hands full with those, but I'm just saying. Yeah,
I know they did a number on us too, but they're my friends. And we address,
But I'm just saying,
those are things that pop
because
up.
we're trying to entice providers, and we don't want to run into the walls where the providers say they won't do it, will not do it, will not entertain it.
We need the help,
Medicaid,
Senator.
yes.
We need the help of this community, all of them, GRMC, the private clinics, because obviously there's not enough of us to take care of all these people. So we recognize that.
Well, the chair is saying that he may be able to put that amount for MIP in the budget for 2020, and I think that would help you. And so, you've done a great job. Public Health has done a really excellent job, I think, in
Do you know how many times we brutalized this paper?
Yeah, and whenever I talk to providers and I ask them why they don't take, MIP
Medicaid.
or something.
Yes.
Yeah, they
It's
give me
because-
kind of, I think, old reasons, and I want to make sure when you do your outreach that they're all updated as to what processing times look like, all of that. I think it's
Senator,
good. Good
I
idea.
have right here the listing of all the claims from all the way, and Sister was very happy at St. Dominic's because she told me that they've been paid up to really unbelievably paid on time. So that was, I don't know about Guam Regional Medical City, we're working on their claims, so we're still working on getting that through.
All right, thank you. Thank you, Mr. Chair. Thank you, Linda. Thank you, Tom.
Thank you.
Thank you. Senator Lee, you have another follow-up question?
Just one question, Mr. Chair, for Mr. Norcy. So we were focusing on Medicaid, and I wanted to ask you, I know that we report data on Medicaid and CHIP, and we use various CMS forms to report certain kinds of data, but it's my understanding that other territories, and Guam included, were not required to submit quarterly statistical and program expenditure data for CHIP. Is that the case?
No, we have to submit data for all our eligible people. I don't know. That's what we always do.
So I know
So I'm
that
not
we're
sure what you're
required
asking.
under Form CMS 37 and Form CMS 64 to submit those types of data. Additionally, upper payment level.
Oh, yes, the
Upper
upper
payment limit
limit.
payments.
Yes.
But it's my understanding that, like the other territories, Guam is not required to submit quarterly statistical and program expenditure
Upper payment
data
limits?
for CHIP.
Yeah,
For
CMS
CHIP.
64 is expenditure for CHIP.
Yes. And we're required to submit that, correct?
Yes,
Yes.
Are we required to report the use of EPSDT services?
yes,
Yes.
under the CMS 416 report.
Yeah.
Okay, my additional question to you is there any data or reporting that we're not currently doing where if we change and we are, we move to 100% match, that we'll be required to report? Is there anything outside that we're not reporting already that we might be required to report if we move to a 100% match?
The TMSIS is what they're asking.
Yeah.
It's
I'm sorry?
Transitional Medicaid Assistance System reporting.
We don't currently provide that, is that correct?
Yeah,
But we're
we're going to
working
be
on it
working
already.
on it.
Yeah, we're
so
working
that
on
I
we
it.
can
see.
get
So
that.
if we are able to move to the 100% match, then we will be
That's
required to
required.
report
Yes.
that.
Yes.
Can you repeat, what was that?
Transitional Medicaid Assistance System.
Information system.
Information.
I
Yeah,
see.
it's a transitional management information system.
And you're
And
confident?
this is so that the Medicaid is at a certified type of electronic health record
Right.
system.
Yes.
It's
Right.
called an MMIS, Medicaid Management Information System, and it has to be certified.
Right.
So what we're looking into is either having our current vendor to get it up to be upgraded, our
Okay.
current PH Pro, so that it can achieve the certification that is required. And I went to CMS, and that's what we also discussed. And that's
Understood.
what they're requiring the other disaster areas to do, like Virgin Islands and also not only American Samoa, but also Puerto Rico. Yeah. So that's what they've been doing, and they're required to do that.
So it sounds like you have a plan for that.
Yes, we are discussing it, and Tess and I went to CMS and we discussed that, and we're already putting it as part of our plan for the state plan.
I'm just concerned that, we're so wrapped around the idea of moving to 100% match that we're kind of forgetting any of the requirements or any
Yeah.
of the data that might be required
Yeah.
To report back. And I
Yeah.
want to make sure that we're on the ball on that. So if
Right.
the time comes that
Right.
they don't
See, because
rescind that
if you do
100% match.
If you do an MMIS system that's certified, your return will be the better bang for your bucks because you'll have 90% federal dollars that will
Right.
be supported and 10% local match.
Okay.
And that's the aim. We want to get more federal dollars. So in order to do that, if you have an MMIS system that is certified in their standards, then you're going to be able to get that funds.
Susan Smasi. Thank you, Mr. Chair.
Thank you, Senator Lee. Senator Lai, the Oversight Chair.
Thank you. Just a couple more questions. So on the as the compact impact, I thought I had looked at a list of when the Department of Interior came, they gave us this list of compact impact money or other federal funds still available. So I looked for the ones that were allocated to public health. Have you used any compact impact funds for FY19 for Medicaid or MIP?
Not to my knowledge.
Yeah, I didn't see any
I
allocated
didn't see
that way.
anything of the,
Okay.
based upon what I've really studied this
Yeah.
so thoroughly, I didn't see anything that indicates miscellaneous item for other source of funds.
Okay.
And that, as I mentioned, Senator, was why you don't see that
Right.
5.8 million difference
Okay.
because it was not in the
Yes.
FY 2020 budget.
Is compact impact money allocated for Medicaid able to be used for MIP?
I think it's at the governor's discretion as far as what she wants to do. So
There's no federal restriction on that?
It's given to her by Department of the Interior, and it's up to her to decide however she wants
But I
to.
think they work on a list
Yeah,
together, so
right. So
I'm curious about that.
yeah,
Whether
maybe-
whether that money would also be able to be transferred for
Right.
MIP. Okay, and then in addition to covering ER only, 15 million of the lost ACA, right?
The emergency room.
Yes.
Yes.
If you had to go up like, for some additional coverage, is there a way to organize that? Like, I don't know, are
What do
there...
you mean?
Like,
I'm
are there
sorry, I don't-
standards that you can say, in addition to ER coverage, we will also cover this? I'm trying to see how we can get closer to the existing patient care, the current patient care that's available to people in 2019 versus this drastic cutoff in 2020 that they can't go to the doctor for anything except an emergency.
Well, the best route is for them to get seen and not go into the emergency room. So I think a lot more education perhaps we can do, and if
Community
it's
health
really,
centers.
really urgent, then they go to the emergency room. I think that's what we need to stress on. If they do preventive maintenance and they're pretty
Yes.
up to speed and up to par with their regular visits, whether I'm talking about the adults and especially those with chronic conditions, and they have their chronic conditions controlled, then their likelihood of having complications associated with uncontrolled chronic conditions, the less likely they are to visit the emergency room.
All right. Well,
And that's why prevention is the key.
okay, so the option that we're looking at currently is changing the poverty levels for MIP, so cuts off some people who are currently eligible for MIP. And I guess I'm just trying to ask you if there's any other option that keeps these people covered for emergency room and other things, and maybe cutting off some services, but I don't know. I'm just trying to ask if there are any other options besides, changing that poverty level, because it seems very drastic.
And I don't think there's any other
Do you
option.
do you have an estimate if we didn't do that, then what would the liability look like? Or,
The liability,
well, I guess it's not a liability. It's a 15 million ACA that
Yeah.
you're saying we should keep in mind for,
Yeah,
to
that was
cover ACA ER, right?
yes.
What would it be for everything? That would be,
I think that was everything, wasn't it? That was everything. It's just that source of funding was coming from ACA, but that was the total computation for all the emergency room
no, but
visits for
currently you're covering a
COFAs.
lot more than ER with your Medicaid money, right?
Well, we're only obligated to do what is in the emergency room visit for the ACA,
Okay,
for MIP, COFAs.
Right. But you're currently using your ACA money for much more than ER, is that correct?
Yes.
Yes, that's what I'm asking.
Yes.
So we wanted to maintain the current system of care.
Yeah.
And see how much the government could cover. Yeah,
Mm-hmm.
what are we looking at? I know it's huge because we're talking about the entire ACA amount, right?
Mm-hmm.
Is that 74.9 million? Or what
Well,
are you talking?
That.
I guess,
that-
like, how
that
much
was-
health care are we cutting off from the community without the ACA? Or no? And now, are we required to cover this 15 million ER? Is that like because it's ER?
Because of
Okay.
the COFAs, yeah.
Okay, all right.
What are we gonna do? I mean, they don't qualify because
No, I understand.
they're
It's-
less
yeah.
than 6 months resident, right? So if they move here, they have to establish residency of 6 months to
No,
qualify.
I understand that part. I guess I just want to see what's the difference. I mean, I'm trying to get my head around this huge cutoff. What's left uncovered?
Well, I think that
And so
there
if they
will
go
be
to
other.
the public health centers,
I think
it's
there will be
great.
other programs within the department that we could probably utilize, like, if it's pap smear screening, we have the breast and cervical cancer that is 100% available. If they need help with STD, HIV, we do have programs that are 100%, available, and there's no pocket expense if they come to here. And if they go to the health centers, then there's the sliding fee discount. And so I think we'll do the best we can as far as how we can maximize our resources to help these individuals. And I think that's part of the things that we are doing with Medicaid patients by having all those that are underinsured and uninsured that need pap smear screening. We've been reverting it for the breast and cervical cancer to pay to help save more dollars.
Yeah.
For
You've
our
been
buck.
doing that already,
Yeah,
right?
we've been doing
Yes,
that.
but even while you're doing all of those programs, public health still kind of used or, 22.9 million on local Medicaid matching to access 74.9. Is that
That was-
relatively accurate? I mean,
No, that's Medicaid. I think
so
it's
I'm just
Medicaid.
saying, so we're cutting off $80 million of services for the people. And I'm just trying to get my head around that. And I know we're probably not going to be able to find 80 million, but I'm wondering, that's my question is to the chair and to you, if should we be looking at more than covering, the 15 million in order
There's
to avert a
always-
crisis?
There's always a way to have cushion, no matter what.
To have
I mean,
what?
to have some cushion. I think that's what you're asking, cushion, so in case we go over our budget, right? You always want cushion.
Oh, no, I'm talking about, we're cutting off the ACA. If you cut off the ACA,
Yeah.
it's like providing right now.
ACA's gonna hurt 'em.
Yeah, that's what I'm asking you. To me, it looks like $75 million worth of services. And so if you're cutting that off for the next fiscal year, these patients lose all those services. And so I'm just wondering, should we be covering more? Even though we don't want to, and, of course, we will try our best to get those other, changes by Congress, those would be best. But, I just don't want to create a crisis, a healthcare crisis, that, it sounds like we're in crisis right now. I don't know. That's how it looks to me because, it's a drastic cut to go
We have
from
to-
80 to 15 or even 11 or 30, 80 to 30, right? If we do what you say is 16 for MIP plus the 15 ACA emergency, that would be like 30 million in services we're going to provide. Even if we did that, we're still cutting off still 50 million of services that they had this year. And is that in a year?
That's in a year.
Yeah, I know you're probably used to these numbers. For me, it's pretty mind-blowing. But
No,
okay. So I'm just trying to be creative
You're
and think
making
of
me
any
have
other
more
way
of a burden
to.
on my shoulders, Senator, because we're
Yeah.
we're
I
really
know.
trying to do what we
I
can.
know
do. With
the
the
government of
limited
Guam is
resources
really in
that
a really hard situation, and
Yes.
I guess I'm just trying to see if there's any other.
That's why I go to Washington D.C. to fight for
alternatives.
Guam.
Yes, and you've done a very good job. So I want to thank you all for that.
Me and Tess, yeah.
Yes.
Okay.
All right.
So we'll keep fighting, and we keep attending meetings and keep the federal government up to breast and up to par with what we have. But if I get anything from Congress, I sure will let you know, and hopefully it'll be good news.
All right. Thank you. Thank you, Mr. Chair.
Thank you, Senator Lai. And Linda, we'll contact DOA and BBMR to make sure you get your funding to travel and go get us more money. Okay?
Thank you,
This
Senator.
concludes, Ms.
I'm
Denardi.
tired of traveling already. I already told my staff I don't want to travel for a while. I have so much work to do. So, anyway. But it's
this
for a
is-
worthy cause.
It is now 2:23, and this will conclude the budget hearing for the Department of Public Health and Social Service. The committee will continue to receive testimony for the next 10 days. Please address your written testimony to the Committee on General Government Operation, Appropriation, and Housing, and submit it via email, Senator Joe S. San Agustin @gmail.com. Jesus Masi for your attendance and participate in today's hearing. And for those at home, thank you for watching. The budget hearing is now adjourned. It is now 2:23. Thank you.